What is a beta blocker? Well, it's a drug that blocks betas, of course, and today we're going to find out exactly what that means. We're going to talk about beta blockers, why you need them, what the side effects are, how they were discovered, and even, for you geeks, the proper pharmacology. Now, this is part of a series I'm making all about drugs to help empower you to understand what it is you're actually taking, because it turns out a lot of us don't really know what the pills we're taking actually are and how they work. Now, if you're not a geek, you may not watch to the end of this video, but it would really make my day if you could subscribe to the channel and share this video onto anyone who might find it useful, be it someone who takes the drug itself or has one of the conditions we talk about, pharmacists, nurses, doctors, or just your mate who loves the drugs. Now, you probably know beta blockers by their drug names. In the UK, we tend to dish out things like Bisoprolol, Atenolol and propranolol, and the US, things like Metoprolol and Carvedilol. And one thing's for certain, when you look at that list, you know that laughter really is the best medicine. Sorry, look, so you've probably been prescribed a beta blocker for one of four reasons. Number one, and by far the most common reason, is for some cardiovascular issue. For some people that's angina or high blood pressure. For others it's because of heart failure or if you have a fast, irregular heart rate. Number two is a bit rarer, and you might have been given a beta blocker if you have a hormone condition like an overactive thyroid or a pheochromocytoma, which is a great word for Scrabble. Number three, then you're into some specific ones like helping with conditions of the central nervous system like anxiety, migraine or essential tremors. And finally, in an eye condition called glaucoma. So to understand how beta blockers work, we need to talk about a very natural thing that humans do called the flight or fight reflex. So you've probably heard of adrenaline or epinephrine if you're from North America or Japan. Where have I seen those countries do something different before? Now, this is an example of a neurotransmitter called a catecholamine. There are three of them: adrenaline, noradrenaline and dopamine. Dopamine is mainly in the brain, so let's ignore that one for now and talk about the other two. Adrenaline and noradrenaline are produced in your nerves of your sympathetic nervous system, more on that later, or in a big way in your adrenal glands, which are adjoined to your kidneys. Adrenal. Oh, I get it! Now, when you get attacked by a lion, your body freaks out and you get your flight or fright response. Your adrenal glands smash out a bunch of adrenaline. Adrenaline then circulates around your body and binds to adrenoreceptors. These receptors are in a lot of places that help you in your effort to run away from the lion. Your muscles dilate to take in more blood, your heart output increases, you breathe more deeply, your pupils dilate, and your blood sugar levels go up so you have more energy. There are two main types of adrenoreceptors, alpha receptors and beta receptors. Beta, you see where we're going here. So beta receptors are mainly found in your heart, but also in your kidneys, muscles and vasculature. So when you block those receptors, you block the effect adrenaline has on those organs. That will do things like reduce your cardiac output by slowing your heart down a bit and reducing the amount of oxygen your heart needs. Useful if you have heart pain or have a fast, irregular heart rate. It can reduce your blood pressure, again, initially by reducing your cardiac output, but eventually by acting on the kidneys, which does the same thing as well. And there's lots more in between. Importantly though, even if you use beta blockers, you'll still be able to run away from that lion because your heart has some excess reserve. So if that was one of your concerns, don't worry about it. Beta blockers tend to be tolerated quite well, but they can cause side effects, and your doctor will probably want to keep an eye on you, especially when you first start taking them. Because they slow your heart down a bit, they can reduce your exercise tolerance. They can make you feel a bit more tired and a bit more fatigued. Because they constrict some of your blood vessels in your hands and feet, they can cause your fingers and toes to get a bit cold as well. Dulling down your central nervous system can also bring about general malaise over time, and some people, depending on the type of beta blocker they take, may have some pretty vivid dreams and very rarely hallucinations. If you have asthma, you probably shouldn't take a beta blocker unless you're under a specialist, as they can cause your airways to shut down a bit. Fine in the average person, but bad if you're an asthmatic. Similarly, if you have type 1 diabetes, they can mask that feeling you get when you go sugar low, so be careful there. Ultimately, as always, if you don't feel right when you're taking a drug or you have some concerns over what you've been prescribed, just talk to your doctor. Ready for some Nobel Prizes and some ethical dodginess? Now, as I mentioned before, in order to know about beta blockers, we need to know about what they block. So we need to know about adrenaline and catecholamines. So let's start in the 19th century with a few disconnected experiments which start to build the picture. Number 1, Henry Salter. He was working on asthma and noticed that if you made someone violently emotional, it had an immediate effect on curing an asthma attack. This was probably because adrenaline was being released. But how he made people violently emotional, I don't really know.
I swear to God. Swear to me!
Number 2, at the same time, a French dude called Alfred Vulpian was dissecting and playing around with human bodies. He did an experiment where he found that part of the adrenal gland, the adrenal medulla, reacted to ferric chloride and turned green. Now, other parts of your body and organs didn't do that, but if you test the blood near the adrenal gland, it also turns green. So he realized where adrenaline was released from. And then number 3, a German chap called Carl Jacob. Now he saw that your digestion and waves of contraction in your gut were stopped immediately when you stimulated the adrenal gland. Now think earlier when we said flight or fight for the sympathetic nervous system, well the opposite of that is rest and digest, which applies to the parasympathetic nervous system. So you can see there's a bit of a balance going on there. With all these fragments pulled together, step in George Oliver from Yorkshire and Edward Schaefer, Professor of Physiology at University College London. Now, Oliver had found a way to measure the diameter of arteries, which get bigger and smaller. When your arteries relax, blood pressure goes down, and when your arteries constrict, blood pressure goes up. So he got some extract from the adrenal gland of a calf and injected it into his son. Yes, you heard that right. These were the good old days of research and experimentation when you could inject your kids. Now, he noticed that his son's radial artery constricted, and that experiment was repeated on dogs, and when he joined forces with Schaefer in front of some really powerful physicians in London. They thought it wasn't going to work, but they ate their hats. And from that, adrenaline was then purified from the adrenal gland and started to be used as a treatment for things like asthma and thyroid conditions. So we knew what adrenaline was, yes, but we didn't know what it binded to. Well, step in Raymond Alquist, who figured out 2 major areas where adrenaline seemed to have an effect. In the muscles, which he called alpha receptors, and in the heart, which he called beta receptors. Now, jumping ahead slightly, after World War II, there was more of an interest in heart conditions like heart attacks and angina. Angina being a condition where you get chest pain because your heart isn't getting enough oxygen and because its coronary arteries are beginning to block up. Angina often leads to a heart attack. Now, this was an important topic for a Scottish scientist called James Black, whose dad had died suddenly from a heart attack pretty recently. He knew that things like exercise and high emotional states cause chest pain, and he knew that was probably because of adrenaline. So he wanted to try and block the action on the heart. He didn't want to block all the adrenaline. He wasn't interested in the alphas. He was only interested in the betas. He just wanted to block the heart receptors. Now, working at Imperial Chemical Industries, he set to work studying one of the beta receptor agonists or activators, that's the opposite of a blocker, called isoprenaline, and realized that there was a derivative of it called dichloroisoprenaline, which seemed to have the opposite effect. Now, sprinkle on some medical chemistry onto that and you get propranolol and propranolol, the first 2 beta blockers. These have since been banned because they're pretty dangerous, but a derivative of them is called propranolol. And propranolol is considered the first proper beta blocker. It's considered the benchmark to which all other beta blockers are compared. Time goes on and more beta blockers have been invented. Some of them are more potent than propranolol, some of them are less so. Some work in a generalized adrenoreceptor blocker way, others are highly targeted to a particular organ. Needless to say, pretty much everyone here got a Nobel Prize, apart from Raymond Alquist, who died before he was nominated, and you do have to be alive to be nominated for a Nobel Prize. Ironically, he died of a heart problem. So how does it work in a bit more detail? Well, like I said, there are adrenoreceptors all over your body to which catecholamines like adrenaline and noradrenaline bind to and cause a reaction inside the cell. Basically, if a lion attacks you, you see that and shoot some signals to your hypothalamus, which in turn activates the sympathetic nervous system, causing electricity to shoot down your spine, out your spinal cord, straight into the adrenal medulla of your adrenal glands, and that causes a massive release of adrenaline into your bloodstream, which then starts to bind to all the adrenoreceptors all over your body. As I said, you have lots of different receptors. You have alpha receptors, there's alpha 1, alpha 2, and there are 3 subtypes of each one, but we'll do another video about alpha blockers another time. And you have beta receptors. Beta 1 receptors are found in the heart, the kidneys, and the stomach. Beta 2 receptors are a bit more widespread and are found in smooth muscles, i.e. not skeletal muscles, but the muscles which are more internal, like the muscles in your gut and in your lungs, the ones that you can't control by thinking about it. That is your autonomic nervous system. Now they're also found in your bladder and in your fat and in your brain and in your uterus if you have one, and in your salivary glands. And there's beta 3 receptors which were discovered more recently and involved in fat breakdown, but mainly we're concerned about beta 1 and beta 2 today. Beta receptors are what we call coupled G proteins, and when adrenaline binds to them, it causes an increase in an intracellular concentration of a messenger called cyclic AMP. Cyclic AMP leads to a cascade of events which have the effect of causing things like increased heart rate and smooth muscle relaxation. Beta blockers themselves are what we call competitive antagonists to the beta receptor. A competitive antagonist is a bit like having 2 keys that fit in the same lock, and if you have loads of this one, i.e. a beta blocker, it makes it harder for this one, i.e. adrenaline, to get into that lock. It blocks it. So beta blockers are either selective or non-selective. If the non-selective ones block beta 1 and beta 2, then there's cardioselective ones which block only beta 1 receptors. There isn't really anything medically useful for beta 2 ones right now. Other ones are even more general than that, and they can block alpha receptors and beta receptors at the same time. There are loads of different ones out there. They have different names, different half-lives, different uses. Most are taken as pills and they're used to treat your heart and your blood pressure. Some of them are topical though, and that's when you use them in your eye for glaucoma. And there you go, beta blockers. Makes you a bit more chilled out next time you get attacked by a lion. Loads more drug explainers in this series, so see you next time.